My name is Evan Grant. I'm going to be presenting on the grand challenge of closing the health and social determinants. So social determinants are considered to be aspects of life such as living, education, work environment, recreation. So like living, play, um, economics, stuff like that. So patients' social conditions contribute just as much of the quality of medical care they receive and the population's health behaviors. So like, what is the population, such as like in this certain community, what are their health behaviors, and looking at big picture like America's health behaviors, and all the way down to the level of like a community or small town, what are their health behaviors, such as like looking at race, kind of beliefs and everything, kind of shaping what are the conditions that contribute to these. Organizations for health and health research are aiming to address barriers that communities are having towards seeking health. So like seeking health from hospitals, seeking treatment, stuff of that nature, and making it affordable as well, because depending on where you live, such as if you live in a low economic town or where finances are, the average is really low, well then more than likely their quality is going to be low just because of their ability to afford quality care, and that's where like the gap is. The issue with the medical model, just after reading this article, the issue with the medical model is focusing more on like, there's a problem, here's how we solve it, here's how to get the job done, but it just looks at like, what's the illness, what is causing the problem, not about the social aspects that affect treatment and affect the problem in general. Like, it's getting, as I said in the slide, issue is that treatment is simple, but getting people to the point they can receive it, it's the much broader issue. Between economic factors like, can they afford this treatment, healthcare factors like, are they physically able to receive this treatment, so like, what's the age, are they taking care of people, so like someone who, like a mom who's having to take care of her mom, so if the daughter has, so let's just say the daughter is having to take care of her mom, well if the daughter has cancer and needs to have treatment like chemotherapy, then it's going to, like, her decision to receive the chemo versus taking care of her mom, what is the priority there? And those are the social factors that you need to look at, like in home life, that may prevent them from receiving the quality treatment. They may pick an alternative where they are not receiving the actual benefits they need. Merging technical with everyday. What I mean by the name of this slide is that mixing technical terminology, so medical terminology, with everyday language. So social workers' roles in healthcare are to be translators for medical professionals to patients and to families. Having a knowledge of medical terminology and making understandable to everyday person is a skill in itself. Making the people and the families and the clients that you're seeing able to understand what's going on, what the issue is, while still also using the technical terms and the medical terms that they need. You also can give them an explanation of like what the care is going to look like, what treatment after treatment is going to look like, what discharges are going to look like in mental health and in health settings. So there is a little bit of difference in the mental health and the health settings, just because of discharging and aftercare and the priorities and kind of requirements that you may see in that. But it allows kind of there to be a middle person between a family and the doctor. A social worker has the ability to adapt treatment explanations and services to each individual client. That's a skill in itself. Making a person's treatment plan individualized involves getting the person in their treatment team, getting the family involved for support, and making it affordable, and making sure that they can it fits their style of their life, because where it is, like compared to where they live, like, so where treatment is compared to where they live, is it and do I have the available time to go there, stuff like that. Another aspect of being a social worker is that we can use the person environment theory that makes the professional see the person's illness and health conditions have contributing factors from their social life. So like, if their family life's not going too good, maybe their illness and their health conditions are not going to be as good. If they have the supports, they will also have like more supports to like benefiting from treatment is probably going to be better, just because they have the supports and their motivation to seek treatment will be better. Prevention and care management. With the ACA, so the Affordable Care Act, and the healthcare reform, opportunities have arose for better quality prevention care and care management with a cost to the financial aspect of capping coverages and limiting access. Like in NQTLs, so non-quantitative treatment limitations, because since like in the mental health realm, since therapy is qualitative rather than quantitative, it's hard to show numbers. So like when it says capping coverage and limiting access, most insurance companies are going to try to get you to do the lower costing treatment options, and sometimes limiting those treatment days and such of that in the particular mental health field. In the health, it also might limit what treatment options you have. But that is why the opportunity for looking for prevention care is such a high priority right now, that people are seeking prevention before issues really arise where they're having to seek treatment when they're past the prevention part. Prevention care management, helping clients transition from one form of care to another is a social worker's responsibility. As a therapist and case managers, you can individualize a client's discharge plan and make referrals that work for the client base. This is going back all to individualizing their treatment plan and their around their life, around their social life. So maybe if they don't have a car, their friends can take them to an appointment, or if they're having to seek childcare, they can arrange it around that. It makes them available to seek the treatment, and also gives them a little bit of autonomy in what they're looking for. But as social workers, we are in most cases required to at least look for, or to set up aftercare with either psychiatrist, and mental health field psychiatrist, therapist, and in the health field I'm sure therapist and physical therapist and stuff of that nature, depending on what treatment or what your illness or surgery or any of that nature was. So 6 system level strategies for decreasing the gap, for bettering the gap, is increasing social work leadership in healthcare. So looking for the opportunity for social workers to change America's standards of provision of healthcare. So basically look for opportunities to work with the leaders in healthcare to show that social workers have a cemented spot in healthcare, that we are viable, we are adaptable, we can work in any situation, and work on the leadership and showing that our opinion matters, and that the fact that we're very important to any healthcare facility and environment. Leadership training in schools and practice sites, basically advocacy by working through the system, from working advocating for our clients, advocating when we're on our job sites, showing leadership at an earlier stage to students, such as myself, would be really beneficial, as we're trying to get more funding and everything for through the ACA for our clients, to show that they really need the treatment and everything they're doing through now, but also advocating for more roles in hospital systems or in healthcare systems, such as even going to the point of showing how important we are in insurance roles, which leads into the next one: public relations, conveying the importance of social workers across the healthcare system, from all the way from treatment teams, so the importance of working with doctors, nurses, and even insurance companies, the public and funding of healthcare systems, all the stakeholders, showing the stakeholders how important we are, and making sure that our messages to the public are seen in a very positive nature. So social entrepreneurship is when we look for opportunities of research in specific areas where we can kind of guide our own research and accomplishing the goals in the field, making finances better, looking for better alternative treatments, and kind of guiding ourselves without having medical doctors and other health professions kind of guiding us. It gives us it goes back to the leadership, where we're kind of taking responsibility in our own roles. Transdisciplinary and interprofessional education and training, working alongside other professionals in collaboration for the benefits of clients and target populations, going back to treatment teams, working with nurses, doctors, insurance companies, and educating others on how we can work better as a team, where no one is leading in a sense, and everyone's say is beneficial, everyone has beneficial input, and finally social work research, creation and implementation of community-based studies, looking at communities, race, demographics, all the above, and how we can implement that to make America in general better healthcare, and ending this gap, and just how to implement, start small, micro, and then work our way to macro. And this is the reference for this article and this study. Thank you for listening. Have a nice day.